Hi, Dr. Sasse here from the Continence Center in Nevada. I just want to address a little bit bladder problems in men. And if you hang in there till the end of the video, I'm going to give you a couple of key points that I think might be helpful to you if you're experiencing some bladder problems as a man, or your man is having some problems and you're trying to help him out. Let me just say that lately I've seen a number of men who've had pretty serious bladder problems and really have not been getting answers in the kind of rest of the doctor world. The primary care docs have done a good job trying to send them to specialists, but even the specialists have often not been able to serve them. I just saw a couple of folks who'd been sent to, I won't say their names, but big tertiary university referral centers, and got a lot of tests done, but got no therapy offered to them and are really stuck in the same boat. So let me try to speak a little bit to that and offer some potential solutions if you're sort of wondering what to do. First of all, what kind of problems from the bladder can men get? Well, they fall into a bunch of categories, and the difference is that women get them more often, and women have additional risk factors of pregnancy and childbirth, which often sets the stage and can make the problems worse. But men also can experience leakage, bladder leakage, or incontinence. That's generally a factor of aging, but there can be a number of other factors that take place. And men can also experience overactive bladder, so sense of smaller bladder capacity, some sense of spasms, some leakage associated with it, some sense of urgency with it. Men can also experience difficulties that are more related to the prostate, meaning the prostate grows, it gets in the way, and makes it hard to empty the bladder. So it can be difficult to start the stream and empty the bladder. And those are just the beginning, but that is sort of a big portion of us who have some kind of bladder trouble. If you're not getting answers, the traditional beginning approach is going to be examine the urine. It might be to examine the prostate and then elicit exactly what kind of trouble a person is having. Certainly for the prostate problems, which are so widespread, and all of us basically age into experiencing that to some degree as we get older, there are medications that can shrink the prostate, and there's surgical interventions that are good at opening up the stream and allowing the bladder to not get blocked up from the prostate. So we have a pretty good path with that under the urologists, and so if that's kind of your symptoms, then you want to get a good opinion, or if you need to get a second opinion with a good urologist, then that's going to be helpful. The other category of problems, though, bladder leakage and overactive bladder problems, are often more challenging, I think, for some of the specialists to treat and recognize. So one of the first steps is to kind of be clear about what is really bothering you, what's really making it miserable. Is it the fact that you're having to wear a pad and the pad is wet, or you're having accidents that are causing you to wake up at night or have to get up at night because you're having bladder urgency or overactive bladder 2, 3, 4, 5 times a night and it's interrupting sleep, or causing you to curtail or miss events out in the world because you don't want to have to be spending every moment thinking about where the bladder is going to take you, where the bathroom is, and being worried about having an overactive bladder sensation and having accidents or leakage. And if that's the case, then the kind of initial approach that we take is to really, in a detailed way, ask what a person is experiencing, and then investigate it with the same kind of examination of the urine and the physical exam. But most of this is going to boil down to some dysfunction of the neuromuscular functioning of the pelvic floor involving the bladder sphincters. And over the years, medicine has not been really great at solving that problem. This has been true for both men and women. More often for women, they've been offered surgical approaches, especially for the urge leakage or urge incontinence, with placement of a hammock or a sling under the bladder neck, but that's less done in men. And so there's often been no real great treatments that have been offered to men, other than doing things like modifying when you take fluids, cut down on drinking liquids at night so you don't have to get up in the middle of the night to go urinate. That's not really a satisfactory answer to the problem, although it might help a little bit for people in early stages of it. And potentially doing some bladder and pelvic floor exercises. Sometimes that can help a little bit. Really, at the end of the day, though, what we've seen as the biggest breakthrough in terms of solving that problem has to do with the technology of neuromodulation. And neuromodulation, if you know from our center and other centers around the country, has been a pretty astounding technology in a number of different areas, and we're seeing that neuromodulation has allowed improvement in the function of places in the body where we otherwise don't have really great tools. It's not very easy for me as a surgeon to go in and operate on the bladder and make it better so that someone doesn't have leakage and doesn't have urgency and doesn't have to get up in the middle of the night. This is more of a problem of the communication between the nerves and the muscles, and it's not something that my surgical stitching can really correct very easily. But a much less invasive, and it turns out very highly successful method of solving that has been sacral neuromodulation, where the sacral nerve plexus, which are the nerves that start to head down in sort of a family of nerves down in the pelvic floor that innervate all of that whole pelvic floor musculature and bladder sphincter area, can be helped, can be stimulated with a gentle current, and if it's positioned in just the right way, it can restore the function of the bladder and the sphincters so that it works in a way that's much more normalized. So the vast majority of people, when they have this sacral neuromodulation done, will have no leakage or very little leakage anymore, and also will have return of a much more normal kind of functioning bladder where they're not constantly feeling an urge and having to look to the bathroom and not having this overactive bladder sort of symptomatology. So sacral neuromodulation sounds like some kind of big invasive thing or something involving major surgery, but in fact it's a very minimalist sort of procedure that usually takes about 20 minutes or 25 minutes, and it involves just some local anesthetic. You don't have to have general anesthesia. We do it in 2 stages, however. The first stage is a test or a trial run where we just use some local anesthetic around the tailbone area. We place these 2 little cat whiskers that are really fine leads through the natural canals in the tailbone area, and we use a computer to stimulate your nerves and muscles, and we see what response we're getting in the pelvic floor and the sphincter areas. And then the person goes home with a temporary device that's just taped to the skin for a few days and tries it out. Most people very quickly find that, wow, I'm not having to get up at night, I'm not having accidents, my pad's dry, don't have to run to the bathroom, etc. And then the second phase, if the person says, yeah, the trial was a success, the second phase is again maybe 25 minutes, some local anesthetic, tailbone area, but this time the little device, which is a little gizmo you may have seen me on other videos holding up, is placed under the skin around the back pocket area, and then it goes to work, and it is kind of silently in the background delivering this little gentle current down to the key plexus of nerves, which is delivering the key signaling to the whole pelvic floor, and probably has some other complex mechanisms that actually involve talking all the way up to our brain and down through the spinal column to the nerve plexus in ways that we don't even fully understand yet. But the result, what we can say empirically from these studies over the last 25 years, is remarkable. In the last FDA trial for the most recent devices, over 90% of people experienced success, and that's generally what we see in our clinic here at the Continent Center. Is nearly everyone is over the moon about how effective this is. So it really has been quite a helpful therapy, and I can't tell you how often I see people who have just bounced around from one sort of highfalutin department to another and really never been offered this therapy, which is kind of a niche therapy, and there aren't that many centers that are skilled at it and have been doing it for many years and who are able to train the outcoming newly minted professionals in all the fields. So it is a little bit of a narrow niche. You do have to kind of spend a little time hunting to find the right person about this, but it's usually well worth it. So if I promised that I'd give you a tip or 2 at the very end, and I would say that tip or 2 is before you see the next specialist, just take stock, do a little bit of pausing, examine what specifically are your own symptoms as they relate to the bladder. Does it have to do with leakage? Does it have to do with a sensation of spasm, overactivity of the bladder? Do you have to get up at night? Do you have to wear a pad? How many times a night are you having to get up? Or is it a problem of starting the stream and being able to empty the bladder? And just jot those down real quickly. That's going to be helpful when you're talking with the specialist. And then secondly, the second most important piece of advice I think I would say is Google in your area who is the specialist who is an expert in neuromodulation. It may be a different opinion that you just haven't gotten, and but it could make a world of difference. So I would advise you to do that. check that out, get that opinion with your symptoms aligning, and just see if perhaps this very non-invasive therapy might be for you. What we found is that this is a hugely underappreciated and underutilized technology, and based upon our years of using it, these are our happiest patients by far. So I hope that it makes a big difference for you if indeed it turns out to be the right thing for you. Okay, I hope that's been helpful. I wish you the very best of luck with that.